Welcome back to Shape of the City. While many mothers like the idea of breastfeeding when their baby is born, continuing it when they return to work can sometimes be a bit overwhelming. An increasing number of local companies are finding ways to support the breastfeeding mother. We'll find out more from Tami Frank from the Lincoln Community Breastfeeding Initiative and Partnership for Healthy Lincoln, and Nicole Osborne from WorkWell. Thank you both for joining me today.
Thanks for having us.
All right, let's start with Tami. Now, first, let's talk about why breastfeeding is important.
There's a number of studies out there that cite the benefits of breastfeeding. There's a 2007 comprehensive meta-analysis that concluded that breastfeeding is associated with a decreased risk of a number of health-related illnesses, including asthma in young children, decreased risk of obesity, type 1 and type 2 diabetes, childhood leukemia, SIDS, and severe lower respiratory infections, to name a few. For moms, breastfeeding is associated with a decreased risk of type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression. And a lot of times when we talk about the benefits of breastfeeding, we think about for the baby, that it's all for the baby or maybe a little for the mom too, but it actually benefits families, employers, and communities as a whole.
Well, let's talk about that a little bit. What are some of the benefits to a company that supports their employees who are breastfeeding?
Yeah, so employers that provide a supportive work environment for breastfeeding moms can benefit from more productive workforce due to decreased absenteeism from sick mom or baby, lower health care costs, and increased loyalty, which decreases turnover, which we all know is a big cost for employers.
Mm-hmm. What about you, Nicole?
Yeah, a lot of the same. So any kind of wellness initiatives, especially lactation support, is going to help to keep the employees healthier and happier. And when they're healthier and happier, they're more productive, they're sick less, less present or more presenteeism, so where they're going to be more productive when they are at work and thinking about work. Yeah.
Good. Now, what role does the workplace have in supporting breastfeeding mothers?
Yes, so there's two laws that support breastfeeding mothers for the work site. One is the Nebraska Law LB 627 and then the Fair Labor Standards Act. So both of those laws require companies to provide reasonable accommodations for those mothers, meaning a private space and reasonable time for them to pump. And then breastfeeding is just a great wellness initiative. And so with any wellness initiatives, you want to get people where they live, work, and play. So at the work site, it's a great place to support breastfeeding mothers.
Very good. Now let's talk about the Nebraska Guide to Lactation Support. How was that developed?
Yes, so WorkWell hosted a community focus group where we had community breastfeeding experts and local businesses where we asked them what role should WorkWell play in lactation support at the work site. So from that we concluded that we were going to put together some kind of a guide where we had local Nebraska laws and a few things that companies can do, and then local resources for communities across the state to support breastfeeding mothers.
Very good. Tell me about some of the key components of the guide.
Yes, so we start off with why breastfeeding is so important and what impact it can make on companies and why you should support it. And then we also talk about how it can benefit not only mom and baby, but it benefits the community and it can benefit partners as well. So anyone within the company can potentially benefit from a mother breastfeeding her child. And then we talk about the Nebraska laws pertaining to lactation support at the worksite, making sure that companies are following those standards. And then we go into policy systems and environmental changes that you can make for your business to support lactation. So policy, just setting policies where you're going to be supportive of breastfeeding mothers. And then systems being resources and initiatives and programs that you can provide for your mothers to support them. Things like providing education and local resources. And then the environment, so providing a welcoming and supportive environment for your mothers if they choose to breastfeed when they return to work, and then also providing that physical space where they can pump.
Very good. What have been some of the challenges to establishing more worksite breastfeeding support?
Some of the challenges are companies don't have that physical space that they can dedicate to a lactation room full time. Some companies just don't have that structured in their building, or they have a really large building with a low female population, and so one location is not going to be convenient for every mother. And so finding that space can be a little challenging, but even providing those temporary accommodations for that mother. So providing a room where maybe it's a storage closet that you're not using so much, you can clean it out, and just for a few weeks or a few months, that can be that room for that return to work mother. Also, some companies need a little bit of funding or to find some money in their budget to renovate a room to make a lactation room more appealing, provide a comfortable chair, or even including a sink in the room to provide more accommodations for that mother. So just making renovations to some of that. And companies not realizing that they can support mothers in other ways rather than just providing a room and reasonable break time to pump, but that there's other resources that they can provide for their employees on where they can get more information and education, and even setting up where they're going to, when and where they're going to pump before they leave, to put less stress on the mother when she returns.
Very good. Now, what advice do you have for companies of any size who would like to add more breastfeeding support?
We would advise companies to look at our toolkit. You can make policy changes, so whether you have a wellness policy or already a breastfeeding policy, making changes to those, or creating a breastfeeding policy. Also looking at what resources you're providing, looking at your lactation room, making a few adjustments, and then looking at your environment. So creating a supportive and welcoming environment doesn't cost any money at all, but then also just talking to your mothers, especially those that return to work and breastfed that are at your work site, and getting their feedback on what they would like to see.
Very good. Now, Tami, let's talk a little bit about some of the community resources that are available to moms, especially when they're home on maternity leave or when they return back to work if they're having challenges.
Yeah, so the Lincoln Community Breastfeeding Initiative is a collaboration of hospitals, healthcare providers, WIC, lactation professionals, and breastfeeding advocates that are trying to provide a consistent breastfeeding information to moms, as well as create a supportive environment when they're in their communities. In addition to having lactation professionals in some of the pediatric offices in town, we're fortunate to have MilkWorks in Lincoln and also in Omaha, which is a community breastfeeding center. Lincoln has 2 peer WIC counselors that can assist low-income moms with any breastfeeding information there. And we also in 2015 started a new program bringing 7 culturally diverse community breastfeeding educators to neighborhoods to support moms of different cultures and different languages. For 6 of the 7 CBEs, English is their second language. So that helps bring some needed resources to the community. And all of this information, or information about all these resources, can be found on our website at healthylincoln.org/breastfeeding, including a soon-to-be-released interview series with the community breastfeeding educators. And or people can visit the MilkWorks website at milkworks.org.
Very good. Thank you both for joining us
Thank you.
teaching us a little bit more about how moms can return to work while breastfeeding their babies.